Chairman, and I was on the committee that did hear this in oversight, and it's very clear to me that as we look at policy and good policy that drives folks into more responsibility for their health care, the Affordable Care Act, which was intended to lower costs, this certainly is not a policy that is sending us in that direction, because now we're going to require people who could normally just go into the drugstore and get something that their doctor has already recommended to them, doesn't need a prescription. Now we're going to have them give their doctor a call. We're going to take more family practice doctor time, which is already limited, and that's going to drive up the cost, because obviously that physician is going to have to charge a price for coming in to see them. So as we look at this policy, we see that this policy does not drive what we want, and that is people taking more responsibility for their health care costs. The Affordable Care Act was, one of its intention was to lower the costs, and we see now that we're driving policy that's going to drive up the cost. So it just boggles my mind as we sit here and we talk about trying to save costs in health care. We're really just doing the opposite of that. Certainly, we're taking away what the whole intent of this is called a flexible savings account. We're taking the flexibility out of it. We're saying there is no more flexibility. And so as we move forward and we look at the policies, I really hope that we'll look at policies that do that drive down the cost rather than drive up the cost, and also put patients back into the seat of being the controllers of their own patient-centered health care. So I think I could not have said it any better than my chairman did about what's going to happen with our doctors and the costs and the time that it's going to take, and I yield back.